that's an interesting thing. You know what's the first thing I noticed when my first week when I was in Austin? I saw more post-op of the spine in my first week in Austin that I saw in my first 7 years here in Canada.
Oh.
And for me in my head, there's a very simple explanation for that. In the States, medicine is a business, and in here is a public affair. So the government's not going to spend money on things that are proven not to work. So if you're going to fall on a table to operate your spine, better be on a wheelchair, having your foot dropping, losing urine, stuff like that. Or we're not operating on you because there's a chance you're going to be worse or stable. And you're not going to spend $100,000 in a surgery that's not going to get people more function.
Yeah.
That was my conclusion of that. I was very impressed, very impressed. And some of my patients, they came for a post-op or for pain in the back. It's not even a post-op because the surgery had gone a long time. But they often had the fusions in the neck, in the back. So it's a business.
It's common. It's
and every
common.
time business mixed up with health, things tend to not turn out well, in my opinion.
And you know how hard it is to treat the patients that get their back fused. It's very hard.
Yeah.
Yeah, it's a system. Wow.
I have a brother in Brazil that did 8 surgeries in the back. And that's most of my interest for the spine comes out of that. And he had an infection. So all the spectrums of red flags that you can think, except fracture, he had it. So my interest from the spine really came out of that. It was my last year in school, as my brother experienced that for the first time. And people don't tell you, they don't educate you enough to be able to take that decision to, okay, I'm ready. I want that surgery, right? My brother didn't have constant leg pain, didn't have any clear neurological symptoms. Looking back now, I didn't know anything back then.
Yeah.
Didn't have major hallmarks that he needed to have to follow on a surgery. Then he got an infection. So maybe a spondylodiscitis would make things way worse. All the hardware had to be picked out. But you're not told. You're not told that you may get an infection. People just assume that you know that, but people don't know that. They don't tell you that, yes, we're going to fuse your segments and you may have less pain, but you may have a harder time put your shoes on, put your pants on, put your underpants on. They don't prepare you psychologically for that. So I think a lot of pain is persistent at a surgery because of all the difficulties they find out they're facing then. They're all related, and it sucks, honestly.
Education, right? Education, everything. So now you just start talking about the physical therapy part of our conversation. So imagine if your brother just passed through a simple mechanical assessment, and how many other patients that probably would be able to avoid the surgery passing through this screening.
And you know what's the fault of the physiotherapy there? Is that society doesn't know us in Brazil. So my brother never had one session, not even TENS, ultrasound. He didn't have a session before the doctor offered him surgery.
That's crazy, right?
So
it's crazy.
It's just crazy. I find it crazy, really. So then ends up the way he ends up usually, right? As the patients we see and all, it doesn't end up well, unfortunately, for most of them. And for at least, as research brings, for at least 50% of them. It's high numbers we're talking here.
Yeah.
And it's lives, right? So I don't know.